Hey, it's me. 360. That's my little work area. The computer's closed. Just drinks and stuff. Nothing on the TV. Nothing over there. Nothing on the whiteboard. Nothing over there's the bag. Diane's my patient. All right. So I'm walking in the patient's room. I'm gonna start washing my hands. And ask the patient their name and date of birth. Do you know their date of birth?
Diane Colby, December 6, 2002.
Do you know where we are?
The Spring Hill Library.
Perfect. Do you know the year?
2024.
And what season we are in?
Spring.
Perfect. Patient is alert and oriented times 4. I'm going to put my gloves on that are really hard to get on. Ouch. While I'm doing this, I am going to just assess, observe the patient, observe their posture, their manner, kind of just an overall first impression. What I can see right now is that the patient's posture is good. The patient's posture is good. She seems pleasant so far. Is cooperative with the things that I'm asking. And yeah. I'm gonna grab my utensils that I'm going to need. Oh. So I'm now going to take vitals. And so I'm going to get blood pressure, temperature, heart rate, respirations, O2, and pain. So are you in any pain today?
No.
On a scale from 0 to 10, 0 being absolutely no pain and 10 being the worst pain you've ever had, what would you say you're at?
0.
Perfect. I'd love to hear. Patient is dressed appropriately for the weather and the occasion. Looks very hygienic, just from an overall view right now. And like I said earlier, pleasant and cooperative. So I am now going to start with skin. Just going to feel around for temperature and everything. Skin is warm and dry and pink toned. Don't see any lesions or anything. There is a scar on the left wrist, a tattoo on the right wrist, and a scar on the right leg, and also a tattoo on the right leg. So we're now going to assess patient's nails as well. Thank you. Patient's nails are short, clean, well-mannered, manicured. Wow. I'm going to do capillary refill. You turn the other way, please. Capillary refill is 2 seconds, which is less than 3, so that is good. So I'm going to do skin trigger. Skin bounced back, so skin trigger is good there. I'm going to also now assess the patient's hair for any signs of lice or psoriasis or anything like that. So far looks good. Perfect. While I'm here, I'm also going to feel around the head to see if there are any contusions or lumps or bumps or anything like that. Don't feel anything like that. Looks good there. Patient's head is proportioned to the body as well. I don't know what that was. I'm also going to assess the tympanic pulse. Alright, tympanic pulse is bilateral and 2 plus 2. I am also now going to assess the patient's eyes. Okay. So I'm going to do a couple of eye tests here. So the first thing I'm going to do is testing the pupil's constriction and dilation. Perfect. Other side. Perfect. Pupils were reactive to light and constricted. I am now going to do another test to see if there's any stigma. So I'm going to have you look straight, and when I move my pen, can you follow it with just your eyes? Do not move your head, all right? Perfect, all right? No stigma there or anything like that. Next thing I'm going to do is test just the eyes movement to see if they are moving as they should. So just follow my pen, right? All right, same thing there, everything looks good. I'm now going to look at the patient's nose. So just look up for me. There is no deviation, no sinus leaking or anything like that, so that's all good there. I'm now going to look at the patient's mouth, so if you open up for me. Just looking real quick. Perfect. Patient's hygiene looks good, mouth-wise. I didn't see any severe swelling or redness in the throat. Uvula was midline, everything like that. I am going to just take a deeper look using a tongue suppressor. All right, open up for me. Perfect. You say ah for me. Thank you. Alrighty. Like I said, the uvula was midline. When I had her say ah, everything moved well inside of there. I got to take an even deeper look into the throat. Still, no white patches or anything like that, no swelling, no redness, no signs of tonsillitis or anything. So, all good there. Teeth look good. The gums looked pretty good as well, so everything's good there. I'm going to have you smile and frown for me, all right? All right, thank you. I was just testing the patient's ability to move the facial nerve as well. I'm now going to look at the ears. Let's put my pen away. And test for any tenderness. Anything hurt there? All right, this other side. Anything hurt there?
No.
Perfect. I'm now going to perform the whisper test on the patient. So I'm going to have the patient hold her right ear. I kind of make sure you can't hear out of there. I'm going to whisper a couple things and see if she can come back to me, right?
22. 48. 65.
Perfect, all right. Now we're going to do the same thing on the other side.
15. 82. 84.
All right, perfect. So patient was able to pass the whisper test. I said 3 numbers on each side, and she repeated them back to me. In the clinical setting, I would do the Weber and Rhine test, which test the patient's ability to hear. I do not have the utensils for that, but in the clinical setting, I would do that. Cannot do that at the moment, though. So I am going to now test the patient's sensory. So there is a dull and a sharp side. I'm going to touch different parts of your body. When I touch it, can you say which side it is on and whether it is dull or sharp? I'm gonna have you close your eyes. All right.
Dull, or sharp, left cheek. Dull, right cheek. Dull, chin. Sharp, right arm, upper arm. Sharp, left or upper arm. Dull, left lower arm. Dull, right lower arm. Sharp, right upper leg. Sharp, left upper leg. Dull, left lower leg. Can you repeat that? Dull, right lower leg.
All right, you can open your eyes. So I just tested the patient's sensory. She did get a couple of them mixed up, but it is pretty normal. It was a pretty hard thing to tell. I wouldn't have any concerns about it if I were to further invest. Maybe I would recommend something for the neurologist just to make sure, but I don't have any concerns about that right now. Going back and looking at the patient, I don't see any signs of like cyanosis or jaundice. When I was saying that the skin looks normal, no signs of that. I'm now going to check for moving on to the patient's neck. So moving on to there, I'm going to have you extend your neck just a little bit so I can just look. Good look here. All right. All right, you go back to normal. There were no bumps or lumps or anything. You have the patient extend so you can have a better look at the muscles and tightens the skin a little more. With a look up just a little bit, thank you. Assessing the patient's trachea. It is midline, and all the rings on it feel normal, so that is good. I'm also going to assess for JVD. So I'm just going to palpate here. And after I'm going to listen. Perfect. So I'm now going to listen to the thyroid for any sign, bruits or anything like that. Okay, I'm sure it's on the right one. Okay, everything sounds good there. Moving on to this side. Alright, everything sounds good there. No signs of any bruits or anything like that, so that is a good sign. I am now going to palpate the carotids. You never do this at the same time because that will cut off the circulation and the patient could pass out if you do it for too long. Very not good. Just gonna palpate here. Okay. And then on the other side. patient's carotid pulse seemed good bilaterally. I know you can't do it at the same time, but they felt pretty even, and the pulse is a grade 2 plus. I would also, at this time, the patients usually have water. I do not really have water around here, but I would have her swallow just to make sure she can swallow and that the anatomy is working well and everything, but do that in a clinical setting, not at the moment. Let's see. I'm going to do all the pulses right now just because it's easier while I'm there. So just at the carotid, I'm going to move on to the brachial. So I'm just going to do them at the same time so you can see. Just like this. Yeah, can forget this, okay? Okay, and then move down to the radial. I'm just going to see here, and here, and so this one. Okay. Now I'm going to do, in a clinical setting, you would move down to the femoral. We are not going to be performing that today, so I'm going to move down to the behind the knees, the popliteal. So forward a little for me. Okay. All right, perfect. I'm going to do now move on to the posterior tibial. Yeah. Oh yeah, she can't see my bad. And now I'm going to move down to the pedal pulse. And at this time, I'm also going to do capillary refill. All right, thank you. Alright, capillary refill was less than 3 seconds, so everything's good there.
Can't put back on my socks.
Oh yeah, good. See, I wanted to do all the feet together. All the pulses were equal bilaterally, so that's good, and we're grade 2 plus. At this time, since I did touch the patient's feet, I would change my gloves, but I do not have another pair of gloves, and the patient is okay with this, right?
Yes.
Moving on, all right. So going back to the neck, I'm now going to do range of motion. So I'm going to have the patient put her ear to her shoulder, and the other ear to the other shoulder, and then go up and down, and then side to side. All right, everything looks good there. I'm also going to do the range of motion, range of motion of the other extremities. So I'm gonna have you put your arms out wide. I guess you can just do one at a time if you really want, if you're uncomfortable. So I'm gonna push down on you. I'm gonna have you push up, all right? Perfect. And then the opposite, you're gonna push down, I'm gonna push up. Perfect, all right. And then on the other side, same thing. I'm gonna push down, you push up. And I'm gonna push up, you push down. All right, she's strong. We're gonna do the same thing with your arms in the front. I'm gonna push up, you're gonna push down. All right, I'm gonna push down, you're gonna push up. Okay, perfect. I'm now going to do I just blanked. Shoulder movement as well. Have the patient move her shoulders up. She's able to do that. I'm now going to test the patient's hands as well. So I'm going to have you squeeze my fingers. Perfect. Thank you. And now the leg range of motion. So it's gonna be the same thing. I'm going to push forward and you're gonna push back, okay? All right, then I'm gonna push back and you're gonna push forward. Okay, perfect. Same thing on the other side. I push forward, you push back. And then I push back, you push forward. All right. Patient is strong, very strong. Good. No muscle atrophy or anything like that. Oh, my knee just cracked. It was equal bilaterally. Not one side was weaker than the other or anything like that. Range of motion looks good. Able to squeeze, able to move all around. Looks good. I'm now going to move on to just making sure I got everything before I move on. Can you open your mouth one more time? This is also going to be kind of range of motion and have you move your tongue up and down, left to right. All right, perfect. Also, going back, when it comes to the eyes, I would do an eye exam, the eye test to see her level of vision, which we do not have that. We would do it in a clinical setting, but I do not have that at the moment. So I'm going to move on to lung sounds. Listen to your lungs. I'm gonna palpate first. Just kidding. So I'm gonna put my hands on your chest and I'm going to have you breathe in and breathe out, right? Perfect. Chest expansion was symmetrical. When she breathed in, my hands went up and back down evenly, so that's good. I'm also going to place my hands and I'm going to have you say 99, all right?
99. 99. 99.
So are we?
99. 99.
All right. Felt vibrations, that's what we're supposed to feel. They were again symmetrical bilaterally. Everything's good there. I know that I have the patient turn around. I'm going to do the same thing on the back. Have a take a deep breath. One more. All right, same thing. Just took a deep breath. Everything felt good. I'm also now going to do the 99 test. So I'm going to place my hands on you. Say the number 99.
99. 99. 99. 99. 99.
All right. You can turn back around. Again, felt vibrations equally, so that is good. I'm now going to listen to them. All right. Okay. There we go. All right, when I place this on you, can you just take a deep breath for me? Up here for you now. So a little bit. Okay, look over here. All right, I'm gonna have her turn around, do the same thing again. Sorry.
You did.
All right, do this. Up here. Didn't hear any wheezing or crackling or anything like that. The sounds were clear and even. Have you had any coughing recently or anything like that?
No.
Haven't heard the patient cough at all on here, so that is a good sign. I'm now going to move on to the cardiovascular system. Should have just kept this on. Gonna listen to heart sounds. Perfect. All right, I'm going to be first listening to the aortic. Now the pulmonic. First point. Moving to tricuspid, so like this a little bit. Alright, sorry once again, and then the mitral. Okay. Heart sounds are good, everything was pretty good there. Didn't hear any like regurgitation or anything wrong with all of her heart sounds, so everything was clear and good there. At this point, just because they're on the top of my head, when I was examining all of her, we were also examining what is it? I just have like optic nerve in my head. What are they all called? All the nerves, right? And stuff like that. So we have the olfactory, which is the nose. So she's able to smell and stuff like that. Everything looked good there. And then we have did I just say that? Olfactory, which is the first one I just said. And then optic, which is the patient's vision, so that would have been tested with the eye chart. And then we have oculomotor, which is if the patient can blink, and then we have trochlear, which is a patient's, if the patient is able to move her eyes, which I tested. And then we have trigeminal, which was the facial sensations, which I tested. And then we have abducens, does and then we have facial, which was when I tested to see if the patient could smile and frown. And then we have the vestibulocochlear, which is the patient's ability to hear, which I would have tested with the Weber and Rhines test that we cannot perform right now. Then we have glossopharyngeal, which is the patient being able to swallow, which I would have tested with the water. Wasn't able to do that though, I do not have water. And then we have the accessory, which does something. And then we also have the vagus nerve, which is the like digestion and heart rate and all that, cardiac stuff. So that I would have tested right here. You know, it is working, and then I will do an abdominal assessment after this to make sure it's working as well. And then the hypoglossal, which is the patient's tongue movement, which I also tested. I think I got all of them. Might have left one out or something, but see if we pick it up later. So now I'm going to have the patient lay down. I'm going to set this down so she's not freezing. I'm going to do an abdominal assessment. Of course. Is it cold? Are you good?
That's good.
Okay. She can see you? Yeah, okay, perfect. I was like, I know it's cold. I did it before on the other ones. The first thing I'm going to do is listen. On all the other ones, you usually inspect, palpate, percuss, auscultate. But with the abdomen, you want to auscultate first because you don't want to percuss or palpate before auscultating because it might move some stuff around. I'm going to put it back on there and listen. So I'm going to listen in all 4 quadrants, starting with the lower right. She's in? No. The other side.
Yeah.
So yeah, I'm gonna go to the other side. BRB. Walking around. Okay. So once again, starting with the lower right, I'm just gonna be checking to see if her vowel sounds are active. We don't want them hyperactive or hypoactive. We just want to make sure that they are present and working. Okay, moving on to the upper right. Now the upper left. And now the lower left. Here I'm also going to see if I can hear the aorta. So I'm just going to see here. This one is hard to find, but should be able to hear. There it is. Okay. Patient's bowel sounds were good. They were active. Didn't hear any weird sounds. Just sounded like the normal gurgling. Also heard the aorta, which is good. And it is working down there. So I'm now going to palpate to see if I can feel any bumps or anything like that, making sure everything's where it's supposed to be. Again, starting with the right lower quadrant and moving my way left. point, tell me if anything hurts, alright?
Okay.
Okay, moving up to the right upper. Oh, that's what I'm doing. The left upper. And now the left lower. Okay, so there, I was just kind of feeling where everything is, seeing if I can feel the liver, pancreas, what's their gallbladder. You can't really feel most of these things, it's really difficult to, but you just want to make sure that you don't feel anything very abnormal there. So now I'm going to move on to percussing, starting with the right lower. Right upper. Left upper. And now the left lower. Alright. Everything sounded good there. Everything sounded hollow like it should be. Nothing abnormal there. Everything sounded pretty good. Alright, you can sit.
Okay. I was like, huh? I didn't know which one, what you want me to do.
Okay, I'm back. Just gonna ask some questions about her bowel movements and stuff like that. When was your last bowel movement?
A few hours ago.
How is the consistency normal to you? You're normal?
Yes.
Is the color you're normal as well?
Yes.
Moving on to your bladder. Do you have any problems urinating?
No.
Any pain while urinating? Urinating? Nothing like that? Moving on to patient's diet as well. Do you have any restrictions, vegetarian, anything like that?
No.
No, pretty normal. Any meals a day?
About two.
About two, that's fair.
And some snacks.
That's how I am. I'm a snack person. You drink a significant amount of water, like a good amount, normal amount?
Yeah.
Yeah, that's good. Keep your body hydrated. Alright, well that's good. Just making sure I got everything here. Yeah, I think I did. If I didn't, I can't remember it. So that's where I'm at. Alright, so I'm done with my head to toe. The one thing I remembered is while I was feeling the patient's extremities, I didn't feel any edema. Alright, that's all I got. Gonna take my gloves off, make sure the patient is okay. If we're like in a hospital or anything like that, make sure she has the call light near her. Make sure she has her phone, she wants her phone. You need anything else from me?
No.
No? Alright. Throw my gloves away, wash my hands, and exit the room. Okay. Hospital 360 here. Oh, I was covering the camera. Everything like that is still the same. Nothing on TV or whiteboard back there, and there's Diane.
Hi, for the fifth time.
Bye!